Sorry about that. Some technical difficulties here. This is Dr. Bittiker. We're here to do our one more of our pauses. This particular time is going to be the prostate pause or prostapause. Now, the prostate is a gland that's in men, and it is used to produce the seminal fluid, which is produced in the ejaculation phase of sex. And if it causes problems, it can show up in a lot of ways. Like, for instance, as men get older, because of a problem with hormones, it begins to get larger, and then men have trouble with the urinations and things like that. They have to take a long time to finish voiding the bladder, and can become inflamed and result in a condition called prostatitis. But the BPH, or benign prostatic hypertrophy, is the number one thing caused with men as they get older, causing difficulty with urinating. Now, what causes that? Well, men have more testosterone in the body, and when testosterone goes through a certain phases and changes, it turns into a thing called dihydrotestosterone. And dihydrotestosterone is the same thing that causes men to develop male pattern baldness, and also, I might add, in women too. Women have some testosterone in their body also. But it also causes the prostate to enlarge, and therefore we end up resulting in benign prostatic hypertrophy. It also is associated with the increase of likelihood of developing prostate cancer. And that's the big thing that most people worry about. So that's the prostate pause that we're talking about, is BPH, benign prostatic hypertrophy, which leads to an increased tendency for prostate cancer. Now, there's a lot said about this. There's a billion-dollar industry built on this, and I want to set the record straight here about what to do about it. Now, I pulled out some articles here, and to show you just how important this is and what the likelihood of people having it. First of all, a lot of men don't know this, but over the age of 50, over half the men, upon an autopsy or some type of test, will show positive for some type of cancer cells in their prostate. That's over half. And yet, most men never die of that condition. So most men, even when they do have prostate cancer, it is not a life-threatening condition. The catch is to separate which ones are. So with most people, it's a slow-growing cancer, and you're more likely there's something else to take you out than that. In fact, only about 3% of the men who actually have that actually die from prostate cancer. The American Cancer Society states that in 2013, approximately 238,590 new cases of prostate cancer will be diagnosed, and estimates that about 29,720 men will die from it. So it's of the men that are diagnosed, which is less than it's a smaller percentage. So I guess the point I'm trying to make is that I'm not saying it's not much of a threat. It is a threat, but don't lose your sleep over it. There's things that can be done about it, and that's what we're going to cover here. In fact, more than 2.5 million men in the United States who have prostate cancer at some point are still alive today. Okay? So if you get a diagnosis of prostate cancer, or you get an elevated test number, and I'm going to cover that here in just a second, don't get all excited. There's a lot of things that can be done, so pay attention here. Now, there was a test that was approved by the Food and Drug Administration in 1994. It was called the PSA test, or prostate-specific antigen test. And this particular test was discovered by a guy in 1970 by a guy named Richard J. Albin. Discovered the PSA test. I think he won the Nobel Prize for that. Certainly a very knowledgeable guy. He wrote an article in the New York Times, an op-ed piece, and it was entitled, quote, "The Great Prostate Mistake," unquote. In other words, he wanted to set the record straight about the PSA test and how it was being misused. This is a quote again from this guy. "As I've been trying to make clear for many years, PSA testing can't detect prostate cancer, and more important, it can't distinguish between the two types of prostate cancer, the one that will kill you and the one that won't." That's a quote. Okay. Albin explains the PSA test merely measures how much PSA, or prostate-specific antigen test, is in your blood. And that alone does not necessarily indicate prostate cancer. So it is possible to have a normal, good PSA test and still have cancer. It's also possible to have a very high PSA test and not have cancer. Well, this is where it gets confusing. So I'm not trying to confuse you more, but let's get to the point here where I'll show you how to work your way through this. This is another quote from Dr. Albin. Quote, "I never dreamed that my discovery 4 decades ago would lead to such a profit-driven public health disaster. The medical community must confront reality and stop the inappropriate use of the PSA screening test. This is the guy that invented it. Doing so would save billions of dollars and rescue millions of men from unnecessary or debilitating treatments. Unquote. So again, here's another example. In 1993, a study was done on men who had died, and they did autopsies on these guys, and 33% of the autopsies showed prostate cancer, but only 1% die from it. That's in the autopsies done. So I'm saying is that the death rate is very, very low. So what do you do? Well, there's some things that can be done, and number one is you think, well, maybe I criticize this thing, but I don't come up with a solution. Well, let me give you a solution here. This is a very interesting study that came out. My point is this, is that if you get a high prostate-specific antigen test, don't freak out. 4 to 10, there's a lot of, in that number, some range between 4 to 10. Some doctors will cut it right off at 4, and others will say you can go up to 10, don't get too excited. So you get a lot of confusion here. I get that. But remember this, there are certain things that can drive up your number. One is sex. If you had sex within 24 hours, you're going to get a high number anyway. If you rode your bicycle or your motorcycle for a long period of time, you're going to get an elevated number. If you have a fever, you can get sometimes an elevated number. If you have prostatitis, that's an infection of the prostate, which is more common than you might think. Again, you can get an elevated number. Also, I hate to say it, but this happens more often than you might think, a bad hair day at the laboratory. I've seen it happen. I get somebody with just a number, we've been doing their PSA all along, also it spikes. Okay, I don't know. Is that really true, or did something go wrong at the lab? We redo the test, we get a now normal number. Now what do? You got one high one, you got one low one. I do it again. And so we get 2 low numbers and 1 high. Okay, I'm going to take that as the outlier, and we'll go with that. And I'm not the only doctor who does it that way. I'm just saying, as one reading, don't get too excited. Also, a reading that bobs up and down a couple tenths of a point, don't get too excited about that either. The test will vary that much. There's some accuracy issues here, but let me give you some other tests that you can do that will put your mind at rest. There's some other tests beside this one. I want to say this is that if you get a high PSA and you follow up and you get another high PSA, you don't necessarily need to get a test where they take a specific part of this tissue, because there's some questions about that. There's some other tests you can do that have been developed that are quite accurate. You may want to ask your doctor about. One of them is, and I'll give you the research on this. This is from the Johns Hopkins University. Researchers have developed a test that may be more accurate because it searches for the blood protein, the early prostate cancer antigen. It's called EPCA-2. The researchers measured EPCA-2 levels in 330 patients and then divided them into 2 groups determined by their prostate cancer and PSA status. The scientists determined that the EPCA-2 level of 30 or more indicated an elevated risk for prostate cancer, and all the men with no evidence of the disease, regardless of the PSA levels and any other cancers or benign conditions that they may have, had an EPCA level of less than 30. Bottom line is, the test had over 90% probability of separating out the people who had a elevated PSA that was associated with aggressive form of cancer and the ones who did not, rather than having to do like some type of biopsy or something like that. There's other tests that can do similar things. There's some new things out there, so don't just be going off a PSA block. Ask your doctor to order another additional test. Now, what do you do if you have an elevated PSA? And a lot of times doctors will put you in this watchful waiting category. Remember, in Europe, with their socialized healthcare system, over the age of 70 in some countries, they simply don't treat PSA cases, elevated PSA, even if they have prostate cancer. They figure the likelihood of that person dying from another disease, other type of cancer, or stroke, or heart attacks, exceeds the likelihood of dying from the prostate cancer, plus the problems that the treatment of that will cause, so they don't treat it. That's the way it's done in Europe. Even the doctors themselves do it that way. But here's some things you can do. Number one is diet. I've seen multiple patients with somewhat elevated levels of PSA go on an anti-inflammatory diet, and it corrects because it's a result of inflammation. That's a part of the effect there. You can go to our website, and we'll show you. You can go to what's called the Primal Palate and enroll there. Primalpalate.com, Primalpalate. You got the ketogenic diet, the paleo diet. You can go to my website, naturalhealthandyou.com, see the video that I did on the paleo diet. That's an anti-inflammatory diet. That right there will bring the PSA down in many people's instances. Also remember, even though it's the paleo diet, most people that don't know anything about the paleo diet think it's a high meat diet. It is not. It's a very modest consumption of protein on that diet. Adequate levels, but very modest. It's mostly plant-based diet. So that's the one thing. You can also go to Dr. Gundry's book. You've heard me mention this before. The Plant Paradox. Excellent book. He has instances of it helping with PSA, some examples in there. Very anti-inflammatory. The other thing we recommend for our patients is a supplement called Prostaflow by Pure Encapsulations. This is pretty amazing stuff. We used to use the saw palmetto extract and also the African pygeum, which worked. It helped control PSA in our patients and also benign prostatic hypertrophy. It worked quite nicely for that. But we since have switched over to this. Now what this is a ryegrass extract. It's what it is. So if you have an allergy to rye, well then this may not be your cup of tea. But let me give you some research here. This is it's also called Cernilton, and here's a study that came out of the Urologic Journal from Europe, 1988. Excellent effects there on the enlarged prostate. Another study that was published in, let me see, this was published in the British Journal of Urology, 1988. 60 men involved in this particular study. Again, very good results. They also used it to measure the inhibition, the formation of PSA. We got good results with that. Also, there's some studies on prostatitis, which is an inflammation, usually of infectious nature. Here's a report, comes from the British Journal of Urology, 1989. Again, here's over 15 patients, and 13 of them got excellent results. Here's another study from the, again, British Journal of Urology, 1990. Very similar results. So it's been used in Europe primarily to get excellent results with benign prostatic hypertrophy, enlarged prostate, and prostatitis. It does that by inhibiting what's called cyclooxygenase and lipoxygenase. And it's also, you heard about the beta cytosterols. That's one of the things that's in here. It's there. It's just it's a especially concentrated form. That's what we use, a combination diet for our patients, and we measure the PSA. So, but get the other tests, the EPCA-2, and there's some other ones out there. Ask your doctor for other tests to separate the ones you got to worry about from the type of prostate enlargement that you don't is not a serious condition. All right. Well, thank you for listening. Remember, share this with your friends if you like it. Go ahead and do that too, and go to our website, Natural Health and You. If you have a question. You want to call in and ask a question, we'll cover it here live on our broadcast here, 800-326-5838. Thanks for watching.